Okay, hello everyone, Dr. Kimball here. I am going to talk today, this is number 5 in the 7-part series of this really amazing topic, how to fix your bulging disc without surgery. There's lots of posts out there from non-surgeons, and I think I'm the only surgeon, at least that I can find, to tell you how to fix your bulging disc without surgery. It's a complicated process to understand, and that's why I've broken it down into 7 different subjects. Today I'm going to be talking a little bit about stem cells, and if you're doing any Googling or research on it, of course at some point you're going to come across stem cells. So I can do a whole nother post where I kind of get into the ins and outs of what stem cell therapy is, what the data is available. I'm just today going to give you a little bit of an overview and how that applies to you fixing your bulging disc without surgery, because stem cell therapy is not surgery. So first of all, what is a stem cell? A stem cell is basically a precursor cell in your body that has the ability to turn into or morph into, evolve into a specific cell type. And it doesn't have an end determination built into it yet, but that it can actually become a new cartilage cell, a new disc cell, a new bone cell, a muscle cell, whatever. It could become anything. There are different types of stem cells. Some of them are stem cells that have partially differentiated and become or chosen a pathway, but they still have some ability to select a different path. Stem cells can come from your body. They can come from placenta of another human being. They can come from your fat cells. So in order to do a stem cell harvest from your fat cells would require removal of the fat and then taking those stem cells out of them and then putting them back in. Sometimes, and probably the most common type of stem cell that we use and remove from your body is a bone marrow stem cell, and that's either taken from the spine or most commonly from the hip. And that can be a little painful, but one of the challenges, at least in the United States, with stem cell transfer is that the FDA has got some pretty strict regulations on what we can do to the stem cells after they've been taken out of your body and then put back in. So they can't be manipulated. The term is minimal manipulation can occur. So we take stem cells, let's say we took stem cells out of your hip, we would then isolate those stem cells. We wouldn't be able to grow them and then put them back in, because that would be more manipulation than is allowed. And so the process of taking your stem cells out and putting them back in is somewhat constrained by our Food and Drug Administration in the United States. One other type of stem cell that kind of gets a little bit around this is taking stem cells that have been harvested from another human being, and those stem cells are then frozen, and then your doctor is able to thaw them and then inject them. Okay, so these are a bunch of different types of stem cells. There's arguments why one is better than another in one application versus another. There's a lot of research and a lot of use for stem cells in the orthopedic literature for knees and hips. There's not a ton of reliable data available for the spine. So where is stem cell used in the spine? Is it helpful? Can I fix my bulging disc by putting stem cells into the spine? If not, why? And what is the problem with it? So here's the deal. Basically, stem cells are injected in the spine in 2 different primary locations. One is into the disc space. And that would sound like a great idea. Putting stem cells into my disc to grow new disc cells. Why would they not just grow? Well, the process for a stem cell turning into an actual disc cell, and I'm using that very lay term, a disc cell, and growing a new disc, very complicated. It involves that stem cell being exposed to lots of other signaling molecules that tell it to then turn into a new disc cell. And so that can happen outside of the human body in a petri dish, but again, we have problems in taking those stem cells that have then been kind of manipulated and putting them back in. That's the challenge, right? So just taking a stem cell without giving it the signaling molecules and putting them into your spine or into your disc that is bulging, which sounds like a really great idea, those stem cells most likely will get into the disc once they've been injected and really not know what to do. And the likelihood of them converting and becoming a stem cell, becoming a disc cell is not as good as you would think. So that's one of the challenges. There are some studies. I can share some of that with you in another post. The other space where stem cells are used in the spine is in combination with something called PRP, which is platelet-rich plasma. Those aren't actually stem cells, so you got to be careful when you're talking about PRP versus stem cell. These different combinations of injection can have different results. So PRP, there's actually no stem cell in it, but a lot of times PRP is used as somewhat of an alternative to a steroid injection or like an anti-inflammatory. And we see, or I have seen in my practice, most of the benefit for PRP as an anti-inflammatory being injected in and around the facet joint complex. Better results I've seen with patients in the neck versus the low back. That's not fixing your bulging disc. It may be or could be related to some of the pain that you're experiencing. It has been used in some cases as an epidural injection as well. I'm not going to get into that, hoping that this is providing some overview as to stem cells. Can they fix your bulging disc? The truth is, remember, the bulging disc is a result of a failure of the outside of the disc. The fabric or the annulus of the disc has somehow stretched or torn. Even putting new disc cells, were we able to grow them, would not necessarily fix that outside of the disc. All right? So the answer is that it's unlikely that a stem cell injection in your disc at this time is going to repair your disc. Unless we learn and have new methods to tell those cells to turn into the right kind of cells in the right location at the right time, those are some of the problems that we encounter. So last of all, what I want to tell you about stem cell injections is these are procedures that can be very costly. There's not a lot of scientific data around them. Patients oftentimes are reaching for anything but surgery, and they'll turn to regenerative medicine or stem cell. And I don't think it's a bad idea, but it can be very costly. Stem cell injection and harvest could cost anywhere from $4,000 to $10,000. Probably on the average $5,000 to $6,000 is kind of the going rate that in our community here in Denver. So if it doesn't work, then you're basically out that money. Your insurance company is unlikely to approve the stem cell injection, so you're going to be coming to pay for that out of pocket. Thank you very much. If you have more questions about stem cells or regenerative medicine and how to fix your bulging disc without surgery, please leave a comment below. Of course, appreciate any likes or any other questions that you have for me along this topic or any other spine topic. I'd be happy to answer for you.